hepatitis B. How is hepatitis B cured or hepatitis cured? In this video, I'm going to be telling you about how the foods you eat to have, if you have hepatitis, and the food you need to avoid if you have hepatitis. I've made a video about fatty liver disease. Please make sure you watch that video too if you have hepatitis B. Also, if you want to know the kinds of hepatitis A, B, C, D, E, we'll have the video here. Just locate them. I'm going to put their link in the description box so that you will easily find it. Now, in the cure of hepatitis, in treating hepatitis, you have to find out the virus, okay, what is causing the hepatitis. In the other kinds of hepatitis like hepatitis A and hepatitis E, it's easily cured. It's self-limiting. Like I said, it's self-limiting in the sense that it goes on their own, it resolves on their own. Most of the times you may even have had hepatitis before and you didn't know that you were you have hepatitis. It just goes on its own and it is acute, okay? But hepatitis B, sometimes hepatitis D, they are chronic. It takes a long period. Please, if you want to understand the kinds of hepatitis A, B, C, D, E, I've made the video. Please just watch that video. You understand the symptoms, all of the symptoms you're having, you understand them better. But this video, I'm only telling you the foods, okay, and how hepatitis is cured for the hepatitis B, because I have a lot of questions about that. So, but hepatitis B, like I said, what is going in hepatitis, the other hepatitis, they will give you antiviral drugs, and within 12 weeks or more, it will resolve on it will treat it. Hepatitis C, but hepatitis B, it's chronic. There is no cure. That's the actual thing. There is no cure of hepatitis. However, your gastroenterologist will prescribe antiviral drugs for you that brings it low. That will bring the viral count low, so that your liver is not damaged. Because if the viral load is high, your liver is damaged and gradually liver failure comes in. Okay, so the goal of treatment is to bring down the viral load, stabilize you so that you'll be okay. The drugs that will be given to you, you will take it almost for a very long time, or almost like your lifetime. It will just go down, but you have to continue taking it. So, having known about that, establish those facts. Remember, I talked about symptoms, all those things is in the other video. I'm putting it on the description box. Let's talk about the food that you have to eat and the food you need to avoid if you have hepatitis. Number one is alcohol. If you have hepatitis, you should not be taking alcohol for any reason. For any reason, you should not be taking alcohol, because you are at risk of having liver cirrhosis. There is more damage to your liver. We are trying to heal your liver. Liver cirrhosis or fatty liver disease, in the case maybe non-alcoholic fatty liver disease. Okay, so first of all, if you have hepatitis, any kind of hepatitis, and you have fatty liver disease, you try to even start managing your fatty liver. That's why you have to watch that video. If you have hepatitis, start lose weight, start managing your fatty liver. So number one thing is alcohol. You have to stop alcohol. I didn't say reduce. You just have to stop alcohol for now. Maybe you gradually reduce and then you stop. Okay. So alcohol causes inflammation in your liver. It causes what is called alcohol hepatitis. Okay, alcoholic hepatitis. Okay, so it causes scar, which can cause scar formation in your liver. So you already having hepatitis, I don't know why you're taking alcohol. Please, you have to stop alcohol. It's a no. Okay, number high fatty foods. Okay, high fatty food, especially fried foods, processed foods, and maybe highly processed snacks. Okay, please, you need to really avoid those foods. For instance, what are they now? Biscuits, I don't know. I barely eat them. Chocolate, ice cream, chips, all those highly processed foods. You really have to mind them. This it increases more burden on the liver already. So we prefer that you boil your food. Okay, you boil your food. You can bake them. Okay, steam them. That's preferable than frying your foods. Okay, or grilled foods. Okay, number 3, you have to reduce your sodium intake. Now, this sodium intake is general, whether you have fatty liver disease or you have or you don't have any illness at all. Please locate that video on ways to protect your liver and ways to protect your kidneys. They are actually different videos. I'll try as much as I can to put the link in this video. Salt, if you have high blood pressure, you should know the kind of salt, how many salt you should take by now. If you are in this page, if you're on this channel, you must have known a lot about salt. You have to really avoid salt or reduce to the nearest minimum, because salt retains fluid. Because of the fluid retention, there's a lot of burden on your liver. Okay, the next thing you have to do is to avoid undercooked or raw food or fruits. Like that, especially fruits. You can take fruit, but make sure they are washed very well. But most importantly, avoid raw or undercooked foods, because they can harbor microorganisms. For instance, shellfish, for instance, undercooked meats, raw eggs, food that are not properly cooked well. You really need to avoid them, because when these microorganisms get in, they can worsen your condition. Already your immune system is already a little bit lower because you are sick at the point, especially if you're you're already developing symptoms. Okay, I forgot to mention, my name is Nurse Merit. I'm a nephrology nurse. Basically, dialysis kidney is my specialty. So if you have questions in regards to kidney, you want to have a book a consultation with me, just click on the link on my bio to book a consultation with me. There's a link in my YouTube channel. It takes you to where you can get my number, book a consultation with me, and you get to speak to me. Okay. If this is your first time, please, by now I know you must have subscribed. Hit on the notification button. Not just kidney, liver. We talk about women's health, your ovulation, how you track your ovulation, so many testimonies, female babies, male babies, twins, and all. Okay, so sorry about the digression. Okay, the next thing is you have to avoid unpasteurized food. Okay, unpasteurized food like dairy products, like there is this, I don't know where you are, but in this part of Nigeria where I am, there is this thing they called, I don't know how they call those things, but it's like milk, but they are not pasteurized. These are milk, that are gotten directly from the cow. Okay, they are not cooked first, because milk goes through a process where the milk is cooked cold, and then so these are directly from the cow's milk. Okay, it's not pasteurized. There is a microorganism there that can go to your kidney, your liver, and even affect your overall health. So please avoid unpasteurized foods, dairy products. See this also in soft cheese, okay, or soft cheeses. They may contain harmful microorganisms. Okay, the next thing you need to avoid, you have to really be careful on what you eat. Okay, avoid eating in places that are not sanitized, because you can get hepatitis A, hepatitis E. I've mentioned it when we were starting this video. So you see, it's also worsening the whole thing. Remember, these are different hepatitis. So you already have your hepatitis, you're incurring more hepatitis, more burdens on your liver. Okay, so please make sure your food are properly cooked, well cooked, and this is a call for all of us to be careful on where we eat our food. Okay, where you just buy your foods anywhere, any fruits that is not washed, excreta may contain these microorganisms, hepatitis, these viruses, and you ingest them. People that actually went to eat themselves, they didn't wash their hands very well, they use the same hand and prepare food, you're ingesting it, and more problems. Okay, make sure your food are cooked properly and well managed, okay, before you eat them, and make sure you warm your food. Don't eat cold food. Warm your food at least a little bit, so that the microorganisms could be heated, and go down a little bit. Okay, so the next one is So the next thing is, please make sure you include exercise in your diet so that your kidney will get more blood supply, your liver, your organs will get more blood supply. Okay, so include, excuse me, exercise in your regimen, except you're chronically ill that you can't, walk. Okay. The next thing is you have to include more plant-based diets, okay, than other food. Like take more of fruits, vegetables, like green beans, cabbage, all those things. Like let it be more of green, let it be more of plants. Make sure that these foods are properly washed. You can wash with salt and rinse thoroughly, but make sure you eat more fruits and vegetables. Okay, red meats, make sure that you reduce it to the nearest minimum. You can eat chicken and all, make sure they are cooked properly. Anything you see like a mold or something that is in any part of food or fruit, just discard that fruit, okay, for your health for now. Okay. What else? So now it now depends on the stage of if your liver has been damaged, what stage it is, what is going on. Your doctor has more to say more on the kind of, because there are some people that will not need some certain kind of food at the stage that they are. They may not even need salt at all. Okay, so please make sure that you consult with your doctor. Avoid oil, the bad kind of oil, like omega-6. Take omega-3 fatty oil, sardines, fish. These are better for you. Canned food, try as much as you can to limit or avoid them. Processed food, indomie, all those food, bread, cake, no. Okay. I just hope this video will help you, and the more information I get about this condition, the more I will. If you want to know more about this condition, I have a video on it. I will try to tag it in the description box. Okay, so let me know if you, please make sure you like this video. Let me know if you have more questions in the comment section. Have a nice day.